Okay, just sort of it would have been April 2020 that we picked up this service or started running this service, and it was commissioned out by the Devon Clinical Commissioning Group, and they talked to the Spires Academy, which is in Torbay, to run a pilot to reduce self-harm and support school staff. So it's just in one school in Torbay, and originally it was 2 staff members that would have been placed in there. So we based the kind of service offer around dialectical behavioural therapy. So it includes some one-to-one therapy followed by group sessions, and those group sessions cover skills in sort of mindfulness, interpersonal effectiveness, emotional regulation, distress tolerance, and something that DBT calls walking the middle path, which kind of a different way of kind of seeing other people's points of view, I suppose, and holding those in your mind. It's not kind of a purist DBT offer, so we don't offer 24/7 support, but we do offer some drop-ins at the school, and there's kind of opportunities for people to get additional sort of coaching support during office hours, and we run a DBT group console, so you know, the staff come together and try and make sure that they're adhering to the sort of DBT model. You know, we refer into other services such as CAMS and other mental health interventions for the referrals that come in, and we have some other mental health services that we run within the Children's Society, so a bit of low intensity CBT, some counselling, and some high intensity CBT as well. We've got there's a 24/7 SMS service that's attached, but that's not it's not DBT specific. So we do give that out to people, encourage them to use it. But that's part of the Shout offer, which is mental health initiatives, which you may have come across. In addition to the support we provide for the young people, we do a lot of work with the school staff, and we help with their assessments of young people. We do a lot of sort of skill sharing and providing them with resources. So we started when the pandemic started, and so that kind of really threw a spanner in the works. You know, most of what we'd originally thought we were going to do, we had to sort of revise, but we made the decision with the commissioners that we felt we had a alternative offer, so lots of you know, use of Teams, and we did do some risk assess face-to-face working groups. We were still in the school while the schools were in their sort of open, when they were, you know, the guidance was changing on a regular basis, but it disrupted you know, the groups that we could run. All the year groups were all sort of thrown out, so really made it very difficult for us to do what we were trying to do. Anyway, we persevered. So we carried out an interim evaluation last year, and we spoke to some of the school staff. We spoke to some of our own staff, and also interviewed some of the young people. And you know, I mean, the school staff were very kind to us. They were very positive about the intervention, and they felt it had a positive impact on the young people and their ability to engage with education. They liked the fact that they had somebody available. They had some knowledgeable practitioners in the school that they could come and talk to about a wide range of issues, so not just self-harm. They they liked the flexibility was in there. They liked the additional capacity it gave them when they were working with young people. Yeah, so I mean, there's a few of the quotes that they said about us. It helped us to do stuff. So a bit of safety planning. We kind of revised the safety planning in the school with the school, and we like to think that we strengthened that a bit. And we did quite a lot of work around. There's quite a few children that I suppose we identified for safeguarding, and I suppose strengthened the links maybe with some of the referrals there as well. In terms of the young people that we saw, so I mean, most in those, in those sort of those, well, it's nearly 2 years, but the first year and a half, we really weren't able to deliver the DBT that we were we tried to provide. We did try some digital offer, some Teams. We tried some Teams groups. We had some take up, but of course at that time a lot of their teaching was on Teams as well. So I don't think that really helped us any. We were just kind of another Teams meeting for them to go to. And we've moved to a blended model now where we offer people the choice to, to use, to see us on Teams, to, contact us through messaging apps, social media apps and things like that, as well as seeing us face to face. And but we've been running the groups and we're just starting to get some data. So it's only a small number of young people that have gone through the whole process. So it takes quite a long time to get people through. You've got kind of 8 sessions of one-to-one, and you got maybe 10 sessions of group work. Yeah, so sort of reasonably, pleased with some of the outcomes that we're getting around that. And then I suppose just the final slide was really just some of the comments that this is just from one young person about their experience of how it had helped them, and sort of the ways that it sort of contributed to them. So I thought I'd just show you that so you could have a little bit of the voice of the child rather than me speaking.